So here we are Sunday morning after a time change. So Alan, we lost an hour of sleep, but um, we're talking about return to healing. And one of the things we talk about, a couple of things we talk about to return to healing and we've talked about here, is the importance of relationship medicine and the lack of significance and also the dangers of basing medical care on numerical measurements. A big theme of our book is that the medical community wants to create illness through numbers instead of through you. And that also flies in you don't need relationship medicine, obviously, when you have just a bunch of tests you can do, which is how our medical system started back in 1911. That was the whole purpose of it. The people who started it believed that talking to patients got in the way and that you just have to do a lot of tests to find out people are sick. And so depression, which a lot of people misunderstand because it doesn't mean you're sad. It's an illness that is debilitating and gets in the way of you being able to live your life. Depression is one of those things that struck me as being A, medicalized and B, turned into numbers. So we have these things called depression screens. There are a lot of them. One of the articles I want to write for American Family Physician, which I brought up a lot of times, is whether these are valid at all. I have yet to find any decent validity for these tests. And they ask you a series of questions to determine if you're depressed. And if your score crosses a certain threshold, you're depressed. With the assumption also, Alan, that's built into the note that we're going to treat you. Because if you find someone has a positive screen, the next question is, how are you going to address that? The assumption is we're going to put you on a pill. And I don't know if you remember, and I have one of these tests in front of me that I want to bring up, but I'll let you talk first. But I don't know if you remember back in the days of the narcotics, when these big pharmaceutical companies who are pushing their narcotic drugs, OxyContin being the famous one, fentanyl just as bad, um, and saying that we needed to have a new vital sign called the pain screen, which was again a numerical measurement of pain. And this needed to be done on every single patient every time we see them. The reason they got that through is because they lobbied Congress, they lobbied Medicare, they have people in the CDC. A lot of people don't realize the CDC, and we talk about this in the book, we have evidence. CDC is financed by and run by drug companies. It is basically an instrument of the drug companies. And so the CDC said we need to have this pain screen in there. And we all were forced to do this thing that we knew was nonsense. And it was all a matter of selling drugs. And now we have that with a depression screen. That is a required part of what we call the wellness visit. We have to do it. But Alan, a couple things I wanted to bring up that I'm gonna, and then I'll shut up. Number one, if you have a relationship with your patient, which primary care doctors like you and I do, we don't need a screen to know when they're depressed. I mean, that is something we just know because we know the patient. Gotta tell you, when you know the patient, you can tell. And number two, to me, this is just another ploy to sell drugs because there's no validity of these screens. You have to do them. When they're positive, you're supposed to put people on medicine. And I think this is just another way the pharmaceutical company has gotten through the CDC and Medicare and everywhere else to make sure that we do a test that will sell drugs for them.
Yeah, well, Andy, I agree with you
What do you
100%.
think?
You forgot one group that is the biggest thorn in my side in the hospital setting, and that's the Joint Commission. So, it was
Oh,
them.
yes.
They were
Right.
certainly behind it in the hospital end. And I'm sure there's not a medical electronic health record that in the vital sign section, pain is not there 1 to 10. And we're going to talk about pain maybe next time because you got it up going on. But I think 1 to 10 is such a ridiculous thing, and I'll talk about that next week. But so you brought up when we started, and it just shot this memory into my brain. So you're bringing up, and you're going to talk about a test called the PHQ-9, and I remember this back from, and I think I'm a little older than you,
Just a
so
little.
so it's got to be about 1990 when I was a young resident in the hospital, and we got exposed to the drug companies at one time, and back then the drug companies were welcome part, and in comes the office is this crowd of people with these kits. and it was from a company, and I remember it now, called Prime MD. And they're behind this kit that was created behind the PHQ-9. And when you look at it, who is Prime MD and who made it? Well, Pfizer Pharmaceuticals.
They're so
And
nice. That's why.
and
They're
and they're
kind.
coming in. Look, we got all these kits for you. And I was like, this is so great. They're bringing me boxes of things. Like, I feel so great. I got lunch. I got all these things. I got mugs and pens. Like, this is the greatest thing. And we're here to serve you. And we're going to give you speakers. And we're going to show you how important it is for diagnosing depression early. Well, what drug came out the same year or about? I don't know this offhand, but I know I was about 26 or 27. Zoloft came out. And Zoloft was, one of the biggest blockbusters after like Prozac and Paxil in there. So I think we should spend some definitely time talking about that. So why don't you tell us about the PH2Q9, and then we'll talk about how there's little evidence for that, number one, and even less evidence that these drugs are beneficial.
Yeah, I mean, I looked up the evidence for these screening tools, and there's nothing good. They're observational studies. There's nothing that would tell me that this is useful at all. So instead of in the absence of data, you just buy people off, and that's the way these companies work. Just like they tried to buy you off as a resident and tried to buy me off as a resident. We were dumb then. We took
No,
anything.
we were young and
Yeah,
stupid, and
we
what's
were
better,
stupid.
and we were poor, like
We were
residents back
poor.
then made like $15,000, and free food was like, yeah,
And trips and everything. I mean,
yeah.
and they were just the good guys, right? They were helping us out. And they were
Huh.
also friendly. They knew us. It was just so nice. We could talk about, we have a whole talk about those guys, those drug reps. So there's a nine question, you have to pass, you have to fail a two question thing, but there's just nine questions, really easy. But a lot of these questions, I take care of primarily older people, are just part of aging. Like you're going to fail this test because you're old or because you work too hard. You're going to fail for that. So feeling tired or having little energy, what do you think, Alan? Is that
Every day.
every day, right? Uh, let me see, poor appetite or overeating. I mean, every day. I
Well, I
feel
do
that.
one or the other. Either I
One or the other.
overeat or I don't
Exactly.
eat.
Well, they give you the choice. Either
You know,
one is.
we don't know the in between.
We don't know. In between it doesn't exist. Um, then there's one trouble concentrating on things. Again, when you're distracted, but all these things happen when you're old. I find feeling down at times. Yeah,
100% of the population.
100% of the population feeling bad at yourself or that you are a failure. I mean, I feel like that a lot, but so do my older people.
Imposter syndrome.
Yeah. So already we got what, five or six questions that if you're like us, or if
We're
you're
going to have to
old,
get hospitalized.
if you're old, you're gonna fail this test. So I mean, this test is designed for you to fail. And then think you're depressed because you're a human being on planet Earth. We all feel this way. By the way, I looked up in the blue zones. They don't feel this way in the blue zone. And that's because they have communities and they are not over medicalized and they are walking and working together. But in our society, you're going to feel this way. But when you're old, all these things are your normal every day. And
Yeah.
now all these old people are going to think they have depression because of this screen. Now, when I talk to them, I can say, look, you've always felt this way, but you're still going to your clubs 8 times a day and you're talking to this one and you're helping with that one. Yeah, but the screen would make them depressed. My relationship with them would demonstrate they're not depressed, but they'd fail the test. And when they fail the test, unless I address it, usually with medicine, I fail my test,
Yeah.
which is that I have to do these quality indicators and do them like the drug companies have told me I have to do.
Yeah. And the people in the blue zones are not watching wars live on TV and, kidnappings and rapes and murders. Like, the crime rates in those places are like non-existent. They don't have to watch it on their TV.
Right.
They're living their life and working their life and spending time with their families. So, you're 100% right. It is a defective test that the medical industrial complex bought into, because what did it lead to? more diagnoses of depression. What does more diagnoses of depression lead to? Lots of therapy, lots of money spent on therapy if you have money. Well, we should talk about that as well, the financing of the mental health system. And we're spending all this money, and then what comes next? The drugs. And we're now spending, billions, if not trillions. I'm sure we spent trillions on antidepressants.
Well, we definitely in the high billions at worst, and because not only that, you have to see people to monitor these drugs, more tests. You end up ending up with they're what we call downstream costs, which
Yeah. Uh,
this usually leads to more testing and more doctors, and then they
Yeah.
find other irrelevant things going on.
And then it leads to more work disability, more time lost from work, more
Right.
people on Family Medical Leave Act, FMLA. So it perpetuates it. Like, what is the cost of FMLA to our healthcare system, or to our nation? Forget the healthcare system. It's astronomical.
Yeah, because you can actually use this as a diagnosis to
Yeah,
get out of things and to consider yourself disabled. And so
right.
you start thinking of yourself as disabled.
Exactly.
And so you basically check out of life because of a test, right? You were doing okay. You just, you needed to be told, yeah, everyone feels like you. Don't worry about it. You're still pretty active. Now you're
And
disabled, and now you have also sucked money out of the system to maintain your disability, and
yeah,
now you feel this way. This,
there's a long list. There's millions and millions of people in this country on permanent disability because of mental illness, and probably half of it has been created by the system. And employers can't question it. Like if an employer questions one of their employees that they're out on leave because of mental health, that you're right. They are protected by the government, people with developmental intellectual disabilities, and certainly people with mental health things. So they are protected by the government. In New York, like we could talk about end of life care on some of these patients. Like these people have to have a painful death sometimes because the people that are out there to protect them don't believe like, we're just de-escalating care because we want to kill people with intellectual disabilities and mental health. I joke at it. It's like, you're destined to die in pain if you have one of these diagnoses.
and the depression diagnosis has basically taken over our entire society. It's almost like a badge now, but it used to be a stigma, and now it's a badge that people wear. Oh yeah, I'm depressed. I can't do that. I'm depressed. But it's created by the medical system. So the distinction between normal behaviors, normal feelings, they've been medicalized. And when you put it into a note and require doctors to do it, now you're creating the doctors who have no time are just going to give you a drug. They're going to skip every other possible thing you could do. They don't have time to talk to you. They don't even have time to know you well enough to realize this test is bullshit. It's not telling you anything. It's telling you you're old. It's telling you you're working too hard. Whatever it is. And the result of the test is going to be you get a drug. And you may not even know you're depressed. You may have just been spouting off at the time. Yeah, I'm tired. I'm not sleeping. I can't focus on anything. Yeah, guess what? That's just normal for most of us. But now you got a drug, and the drug is only going to make the problem worse. But we could talk a little about these drugs
No.
because very bad evidence that they're at all effective.
Well, not only is there bad evidence that they're effective, and there's probably more evidence of the adverse reactions that they create, especially, with the SSRIs. They have unfortunately been associated with a significant increase in falls, GI bleeds, drug interactions leading to these things, increased cardiovascular events. Like the list could go on and on. But the biggest thing is, especially in the younger population, which I'll talk about a little bit, there is an increased mortality rate. So people on these drugs are more likely to die from something. All-cause mortality. All-cause mortality, folks, means that it's not necessarily the drug, but people who are on this drug die earlier. That says a lot. It
And the
says a lot when you're taking a drug.
and just so you know what SSRIs are, serotonin reuptake inhibitors, which increase the amount of a chemical called serotonin in your brain. And this chemical is important, But how do we get serotonin? We get it three primary ways. We get it through the sun when our bodies are not covered by sunscreen, which the dermatology industry wants us to do because they believe that there's a skin cancer epidemic, which, by the way, there's not. Number two, we get it through exercise in our muscles. And number three, we get it from our gut bacteria because we eat well. We don't eat garbage. We eat a lot of fiber and good fats, and we feed our gut bacteria and we make serotonin. All three of those things are basically discredited by the American lifestyle and the American medical community. Obviously, exercise is always pushed, but no one talks about it because they'd rather give you a drug. So yeah, these drugs, Prozac, Zoloft, Paxil, Lexapro is the big one now. But they do the same thing. They increase a little serotonin, but they do like every drug. They're doing other stuff too. They could drop your salt levels dangerously low so you could die. I mean, there's a lot of things they could do. And like you say, in older people especially, they cause falls. That's been well documented. But here's the thing, Alan, we're treating a numerical measurement with these drugs. We're not treating a human being who we never would have put on these drugs based on our relationship with them and our if we have enough time, we'll talk with them about their stressors. We'll talk to them about how to increase serotonin through natural mechanisms. And in the blue zones, they do all those things. So they have loads of serotonin. They're not using sunscreen in the blue zones. So just so you know. And they
Yeah,
don't
and
have
we
it.
we, we didn't
Some,
we didn't even get to the real side effects that actually most people get from these drugs.
oh yeah.
So most people, and it's a significant percent, have total sexual dysfunction or no interest in any kind of sexual relationships. So now you're taking relationships away. Weight gain is huge. So all of these drugs are associated with significant amounts of weight gain, and we're essentially turning the world into emotional zombies, in my opinion. Like, just zombie everybody, give them Zoloft and Xanax and we'll be fine for everybody. Put it in the water.
I obviously, as you can imagine, I'm not a drug-seeking human being. I don't even see doctors. When I had my knee replacement, I said to the guy, just so you know, I'm almost sick. I'm 60 and I've never seen a doctor in my life. And he said to me, well, I haven't either. Why should you? But that's kind of my view. But during the worst of COVID, when I was and I was also in a divorce, I was losing my mind, and my office pushed me to go on a little Lexapro. I can't tell you what that did to me. It was like I had a frontal lobotomy. I
Yeah.
was basically because I was so angry during COVID and I was angry during my divorce. That anger basically just got put in a little spot in my brain. Um, and it was gnawing at me all the time, but I couldn't do anything about it. And I've never felt worse in my life. And we're talking maybe 3 weeks I was on this evil drug. But you know what? Sometimes you got to just deal with your anger and your other things in ways that are not medicalized. And yeah, nausea. It's funny because you look at the side effect, it says it could cause diarrhea, it could cause constipation, it could cause you to stay awake at night, it could cause you to be sleeping all day. For me, I was sleeping all day. It put me to sleep also.
Yeah.
I couldn't function.
You
Three
you
weeks,
can
lowest
function.
dose.
Yeah, fortunately I've never tried to do it, but you're right, Andy. We're actually two very angry schmucks, as we say, because we're angry at this system. The system lies, and the medical industrial complex has brought the Kool-Aid because we wouldn't need all these drugs. Trillions of dollars would have been saved since 19 or early 90s, 80s, whatever it is of this. It's utterly absurd. And the end result is there's an increased incidence of suicide, especially in young people. So, I am pushed a lot as a family doc. I treat all ages. And, if you look at the data, and if you just open the package insert for folks here, if, most people have seen the package insert on a drug. And if you open up SSRIs like Zoloft, Prozac, Paxil, all these drugs, Lexapro, Celexa, there's what's called a black box warning. Black box warnings are the highest warning that, the FDA says on a drug. And what does it say? And it says there's a significant increase in suicide, especially in young people on these drugs. And people are prescribing them like water. It's water. Like, just take your Zoloft every day. It is really, really good for you. Okay. And the younger that you are, the higher the incidence of suicide in these groups.
And during COVID, I don't know, we'll one day talk about that, but our life expectancy in this country dropped by 4 years. Look at Sweden during the same time period, their life expectancy went up. COVID itself raises life expectancy because it's interesting because the average age of death in COVID in this country was 81 and our life expectancy is 77. So paradoxically, more people died of COVID, the life expectancy went up. That's what happened in Sweden. Um, why'd ours go down 4 years? Mostly suicides in young people and drug overdoses in young people.
And people
And
not seeking care for the other stuff because they
and
were
not
scared to
see
get
young
COVID.
people. Again, young
People were
people.
having heart attacks and staying home.
They're told to stay home. So these young people were isolated. They were not allowed to go to school. They were told the world is going to hell for a disease that didn't touch them, by the way. The and so they were put on these medicines like water during COVID. The suicide rate went up so high during COVID that it caused this drop in life expectancy. That the biggest cause of the drop were young people who did damage to themselves. And so you take complete isolation and then fear, and then you throw a drug on top of it, which basically exacerbates your tendency to want to hurt yourself. And then you get a drop in life expectancy by that many years. So, Alan, how many times have you heard the public health people or the people who've ever talked about COVID or how we should do it differently talk about that?
Yeah, well,
Zero.
there really should be, a congressional investigation of why this country did so poorly during COVID. There really should. Our own healthcare system should investigate it. But why aren't we? And why don't we? You know, because some good friends of like yours of Fauci and stuff like that, they were making a killing off this. They were making a killing. Think of how much money was made on a COVID PCR test that, quadrillions of people, bought these kits and are testing themselves like 3 times a week. It was
3 times a
utterly,
day, by the way, in my world.
it was utterly insane. We've definitely spent billions on COVID testing. It,
That's another topic. The point is
me and
that
Andy watched all these people die.
we some
It
die.
was a horrible time.
We did.
And our country just effed it up.
Oh,
Effed it up.
and
Like
we
Andy
don't.
said, why did we die more and Sweden live longer? Like we messed up.
And we still look at Sweden as being the bad example, but that's how sick it is. We have someone who did it right. They actually kept their society open. So guess what? By keeping their society open, kids in Sweden went to school immediately, um, because they immediately knew this wasn't a risk. And they also knew their public health guy said, look, we can't just look at COVID. We got to look at the implications of locking people up too, which people in this country said too, but they were censored. And we could talk about that down the road. I knew some of them. But in Sweden, the depression problem wasn't like it was in this problem. We caused the depression problem. And guess what we did about it? We gave these kids, these young adults whose life we stripped from them, basically, we gave them drugs that were gonna turn this depression into now a desire to hurt themselves. And we just had a suicide epidemic for several years, leading to 4 year drop in life expectancy. I mean, that we haven't seen that since before World War II. So just so you know, more young people died from this in terms of very young than even then. So
It's
but
sad,
we
but
don't talk
true.
about it. We don't talk about it. And the drugs were part of the problem. And the idea that we were not concerned about what was causing this depression in young people, we just didn't care. We told them to shut up and deal with it. We got a pandemic on our hands, and they better just stay at home. With often parents who were abusive because they had lost their job.
Eh,
But it was a good window too, Alan, into what depression will do when it's real, and why do we don't need a stupid test to tell us, yeah, obviously everyone's depressed because their life was just taken away from them and they're scared, usually unnecessarily so. Remember the the fuel that drives the medical system is fear. That
Yep.
makes everyone want to do stuff, and fear causes depression, and depression leads to these medicines, which then could lead to suicide or
Yep.
dysfunction or fatigue or disability, and we get this terrible circle.
And we do a really bad job in this country measuring mortality, like the actual cause of mortality. So I'll give you an example. So most death certificates, which a lot of mortality is measured by, are done by like an intern. They get the job of filling out the death certificate. So you can't die from old age in this country. Everybody dies of a cardiac arrest. Yeah, your heart stops, but
Yeah.
it's the next thing. Like what's next that people put? So you think when someone comes into the hospital after a fall and they break their hip and die of complications or a GI bleed, that any resident is putting, secondary to sets and secondary to SSRIs. It's not put. Like it's not there. So we don't even measure these things because we don't want to measure these things because the drug companies wouldn't want to measure things because it would pretty much show that most drugs are killing people in this country and we're over medicated simply. And the other thing is, I just wanted to mention because I know we're getting late in time. I work in two different worlds. I work in one world. I work in is very underserved, all Medicaid or undocumented or no pay. That's half my world. And the other half of the world where I practice as well is in a lower middle class faculty practice, teachers and firemen and things like that. And I could tell you that the way the system is funded, that, I could get the Medicaid patient who's got no insurance a quicker appointment in this country to see a mental health provider if they need one than I could get my patients. Because my patients, they don't have the money to spend, $500 a week on therapy and things like that. Their insurance companies are paying for it, and there's no providers out there. No, no,
No providers.
no,
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 no.
no mental health provider wants to take insurance anymore. Why should they? If people are going to pay them 350, they don't need a staff. They don't need to do billing. You pay when you go. And the ones that have insurance and want to use it can't get in because there's no one that accepts that. It's really a shame. And our hospital, is begging to find mental health providers because no one wants to practice in my community. We're always short. If we didn't have a residency program, we wouldn't have anyone to treat the patients.
If you want to look at another true payment crime in our country, we talk about how primary care gets a fraction of, let's say, a dermatologist. A dermatologist could work 2 days a week, looking at a couple bumps on you, and make more money than we make in a full
I
week.
think that is the average work week for a
Yeah, it
dermatologist.
is.
Some
It is.
some work three. Some work three.
It is. Those are the ones who are really killing themselves. But they also don't do call. They don't have to deal with emergencies. They don't deal with the complexity of the human body and the psychology. That we deal with all that. But psychologists are equally thrown into a pit. And I have friends who are psychologists. Their payment has dropped as cardiologists and dermatologists has gone up. They're getting the average psychologist gets less than the average school teacher. So fewer people are going into that field, and those who are in the field are often just not going through insurance. They need to get paid because they're fewer. Well, guess what's replaced psychologists? Is nurse practitioners who, by the way, make more money than psychologists, even
Hmm.
though they have no training in mental health at all.
Yep.
They could be a regular old nurse practitioner who's now in charge of you. And studies have shown that when you see a nurse practitioner for mental health, you're getting drugs. And that's what they do. Whereas psychologists, the beauty of them to me is that they can't prescribe medicine, so they don't. So they're dealing with you in a non-medical way, dealing with your issues,
And they have better outcomes.
and they have much better outcomes. And the nurse practitioners who are replacing them and making more money than them are just drugging people. And that has been I can't find psychologists where I am. It's just not possible.
Correct. You can't
And
find a psychologist. Exactly.
and again, no one addresses that either because nobody cares. It's because psychologists can't give drugs. Guess what? The medical industrial complex wants nothing to do with these people because they are not helping them out. They'd rather have the nurse practitioners in there, and they're going to pay the nurse practitioners more for drugging people.
And there's even less neuropsychologists who would actually prove that these people are not depressed, don't need don't have dementia or any of this, just more overdiagnosis, more overtesting, more overtreatment. Our country in the medical industrial complex is effed. It's ridiculous. We're just, it's getting worse. And, I'm always a hopeful. I'm always thinking positive at the end, but it's not getting better, Andy. The whole system is not. The medical industrial complex is getting stronger and stronger. You know, I just got kicked off of like three United healthcare plans.
Oh
What,
God, yeah.
how did I find out? I found out this, I apparently was kicked off in November when they changed some of the plans. And I found out because my patients are getting letters now, 5 months later, that I was kicked off and they're trying to negotiate with me, but I haven't been open to negotiations. I didn't hear from them. I didn't know I was kicked out. How can you negotiate with someone you don't know you need to negotiate with? So I literally had to have a friend who's high up in the managed care world call these people, and he got the explanation of, it's just random computer stuff that they do. Like there's no rhyme or reason to them. It's not like they came to my office and did a chart review and said, you're a crappy doctor, so we don't want you, or, you're billing too much on your patients. It was none of that. They didn't do any of that. It's either a clerical error or just they look to screw up the system.
Yeah, they will pick little pockets and just stop. And
They
this
they they
happened
want to
where we
find
are
reasons
too.
not to pay people.
Yeah, they want reasons not to, especially people like us, Alan, who is are we're not making the money. We're the anti. We're actually hurting everybody by doing good. But I mean, one of the reasons I wanted to have this talk about depression is because I did, as we were talking, I did the 9 question screen on you, and I will be
Do I
prescribing
have
you
to
Lex.
dial 911 to make sure you're not suicidal right now?
We better just take our Lexapro and just and make an appointment with with someone to give us more testing because we also have mental illness in other ways too. But it is, it's funny because when because I know my patients, I don't even do these tests. I just kind of answer
Oh,
them
I don't do them.
for them. That's what I do because I have to fill in something. So
I actually walk in the office. It happened to me yesterday. I walked in the office. I looked at someone and said, "You're not all right, are you?" And they said, "What do
right.
you mean?" I said, "You don't look well. So, are you, is something going on in your life?" And they started crying. Like, I looked at them. When you know people for 30, 40 years, you just
Yeah,
need to look at them.
exactly. Exactly. You don't need a screening test to figure something out. And
An
we
unvalidated screening test.
unvalidated screen test designed to sell drugs is what we've kind of been reduced to. And the vast majority of doctors, that's all they have time for. So yeah, it's just a symptom of how bad our system is, but it's also a direct assault on human beings and creating fictive illnesses that scare people, give them disability, make them upset, make them force them to take medicines. Because Alan, and we'll talk about this one time. I don't, my son gave me an answer to this, but I don't know. Why do everyone buy this? Why does the American population buy this? And my son said to me, look, Dad, when you scare people about their health, they'll do just about
Yeah.
anything. They're not going to ask any questions, and they trust doctors. And we're going to have a talk eventually on TV doctors, because that's irritating to me too. I have to turn up TV shows all the time because they're like gods on they do no wrong, and everything they say is like coming out of Moses's mouth. But a good doctor knows as my friend Andreas, your student says, what makes a good doctor is we know we don't know anything.
Yep.
So a doctor who considers himself an expert or considers himself, always right is a scary, scary bird
Yeah,
because
because
they're
we know how
powerful.
all those experts are proven wrong by the next study. So it's
Always, but then they jump on that bandwagon like that nothing happened. So they,
mhm.
they do just well. Okay, Alan, enjoy your shortened day today.
You too. Bye, everyone. We'll see you next week.
Okay.